This is Mitchell Warren, Executive Director of AVAC, and welcome to the online training course for GPP. From the beginning of the AIDS epidemic, activists and advocates have helped redefine the role of community engagement in clinical trials of HIV treatments and of eventual access around the world. HIV prevention researchers were reminded of the challenges of such engagement during the initial PrEP efficacy trials, some of which were stopped prematurely due to controversies that arose over trial conduct, different expectations among different stakeholders, and varying perspectives on what was true and ethical. This was not the first time there was distrust of medical research and researchers, nor will it be the last. These trials were designed and implemented according to various global ethical guidance, as well as standards such as good clinical practice. But the controversies highlighted that existing standards were not enough. They also reminded us of the challenges of stigma, marginalization, and discrimination that remain at the heart of HIV. These challenges are difficult to navigate and don't have clear right or wrong answers. But it became clear that the field needed standards and metrics for stakeholder engagement. UNAIDS and AVAC published the Good Participatory Practice Guidelines, or GPP, in 2007 and updated them in 2011 to help guide the work to engage multiple groups in the research agenda. Communities of people at risk for HIV, policymakers, community leaders, media, and funders are just a few of the stakeholders that have an important say in the research endeavor and help make research better. 8 years since those first PrEP controversies, we've seen US FDA approval of the first ARV drug for PrEP, and this could not have happened without the active engagement of communities and stakeholders around the world in the ongoing trials, the results dissemination, and the eventual approval process. Born out of those early controversies, the GPP guidelines are increasingly being embraced, adapted, and applied in HIV prevention trial design, implementation, and eventually the uptake of new prevention methods that can speed us toward the end of the epidemic.